The country has been threatened with another outbreak of the Ebola virus disease that was declared on the 19th of this month after an index case was confirmed in Mubende Regional Hospital. As of 28 September 2022, the country has 7 confirmed cases of Ebola, bringing the number of cumulative confirmed cases to 31 and 1 new death. That brings the number of deaths to 6, with a fatality rate of 19.4%.
6 health workers, 4 doctors, 1 anesthetist, and 1 medical student exposed to the index case. What is index case? The first one. Oh. Between 15th and 18th, have tested positive to Ebola and are being managed at Mbende and Fort Portal referral hospitals. They are being treated. That's what, you know, when I read the document of the Minister of Health, I must keep localizing their word. Management as if they are managing a bank. For us in our language, we say they are being treated.
The cases have been confirmed in Mubende, Chegegwe and Kasanda districts. Despite the increase in confirmed cases of Ebola virus disease, the head of state is hesitant to think about a possible lockdown on grounds that Ebola can easily be contained compared to COVID-19.
We who are used to fighting wars, when we had these characteristics of the enemy, the Ebola, we decided that this time we shall fight differently. It's not necessary to have lockdowns, to close schools, to stop you from going to churches, to the markets, traveling. Now, there's also another characteristic which shapes our strategy. Because number one, I've told you, it doesn't go by air. It doesn't go through breathing. Number two, so it only infects by contact. But number two, even with contact, it cannot go through every part of the body. It goes only through a few areas of the body. The eyes, the mouth, the nose, the soft parts. Otherwise, here on the skin, it can stay there. And if I don't transfer it by touching and touching myself, it will stay there until it will not infect me. But there is another weakness on the side of the virus, number 3, which shapes our strategy. This is that although it stays in the body for a number of days, I think it stays in the body for 21 days or something, somebody said, it can be there, but not showing itself. But apparently, before the virus starts showing signs, it is not infective. It only becomes infective once you start showing signs like temperature, vomiting, and all that.
Mubende district remains the epicenter of the Ebola outbreak, with Madundu sub-county accounting for 11 cases and 5 deaths. Mubende municipality 5 cases, with Kampala, Wakiso and Chegegwa underlined as high-risk districts given the high volume of movement. The president, however, issued some preventive guidelines that include regular hand washing with soap, avoiding getting in contact with infected people and fluids and organs of infected animals, and avoiding touching soft parts of the body such as eyes, ears and the mouth.
It is an aggressive disease. However, the good news is that it is not as infectious as corona, the one we have been fighting with. The big problem with corona is that it goes through breathing, airborne. It is airborne. When I sit with you, near you, and you near me, through breathing, you can infect me, or I can infect you. But that's not and that's where corona was dangerous, because you sit in the car, in a taxi, and you get it through breathing. You sit in a nightclub, you get it. In the church, you get it. In the school, because it is going through air. Now, the good thing with Ebola is that it does not go through the air, through breathing. It goes through contact. Contact. My body to be in touch with yours, and the fluids from you or me to reach you.
The president also challenged scientists to come up with a vaccine for Ebola Sudan strain that the country has currently. Sandra Kahunde, Adia Nakuti, UBC News.